Acute external otitis. Acute external otitis may affect the tympanic membrane. Pseudomonas is the most common germ in acute external otitis. The treatment depends on whether the patient has an immunodeficiency or not. Its treatment is categorized. The most critical step in evaluating the patient with acute external otitis is the clinical examination. If the wax is present, removing it is necessary. The patient benefits from the results very quickly. Perform the irrigation with a sterile fluid. Another essential fact is inflammation. The inflammation should be reduced, and corticosteroids including hydrocortisone, dexamethasone, or betamethasone are used for this purpose. Lowering the pH of the external auditory canal is also essential. Acetic acid is used for this purpose, which is found in vinegar. In addition, boric alcohol or boric acid are also useful. Prescribing a topical antibiotic is another step. Animal and human studies have found that quinolones, such as ciprofloxacin or ofloxacin, are not ototoxic. The next point is the application of a warm compress to increase circulation, which subsequently reduces the inflammation. Okay, when a patient refers with an earache, press the concha or tragus. If they feel the pain, acute otitis externa is then suspected. If the ear canal is severely swollen or narrowed, an earwig may be inserted to facilitate the delivery of otic medications. So, as a general rule, all patients with acute otitis externa should be treated with topical medications, except as we will explain later. Ciprofloxacin otic drop should be administered. Ciprofloxacin alone or in addition to betamethasone could be administered as combination therapy. As mentioned earlier, the pH of the external auditory canal should be lowered. Use boric alcohol for achieving so. If the patient's tympanic membrane is perforated, boric alcohol or acetic acid should not be administered, as they might cause a burning sensation, bother the patient, and sometimes cause strange dizziness. Well, if the patient's ear was healthy, prescribe 2% acetic acid or 2% boric alcohol, or a combination of drugs such as hydrocortisone, acetic acid could be prescribed. So, treat some patients with topical medications. Some patients, like patients with severe periauricular edema, preauricular lymphadenopathy, or weakened immune system, must take systemic medications. In patients with weakened immune systems, especially diabetics, on examination of the ear, granulation tissue in the inferior posterior part of the ear canal at the junction of cartilage and bone could be noticed sometimes. This might be a sign of osteomyelitis, and the patient should be hospitalized and receive further treatment subsequently. So, the patient might require an earwig or not. Otic steroids or antibiotics are prescribed if the eardrum is healthy. Warm compress with a towel and a painkiller should be recommended as well. An earwig could be kept for 48 to 72 hours and then be replaced with another one. The patient could also take analgesics. Acetaminophen, ibuprofen, and the rest of the NSAIDs could be prescribed. As mentioned earlier, Pseudomonas is a common germ. Patients over 18 years of age could take ofloxacin or ciprofloxacin tablets. Ciprofloxacin 500 mg tablets and ofloxacin 200 mg tablets could be taken twice a day. Patients under 18 years of age can take cephalexin. Well, this slide shows various kinds of drugs available for treatment. Betamethasone or ciprofloxacin, hydrocortisone acetic acid drops. Ciprofloxacin is available in the form of tablets and capsules. There is also boric alcohol. A combination of ciprofloxacin and betamethasone is available. Slide 3 demonstrates earwig insertion. After inserting the earwig, a drop of the otic drug mentioned earlier is poured on it for 3 reasons. It retrieves the discharge from the depths of the ear canal. It transfers the medicine from the surface to the depths of the ear canal. Earwig also keeps the medicine near the pathological tissue